Yes, I had a gap in my front tooth as a consequence of the fact that my tooth had cracked. It had been filled on a couple of occasions, and essentially filling had unfortunately fallen out again. I was told by my dentist that he couldn't basically replace it, so we would have to consider further or alternative treatments. Although I don't particularly care about appearances. I've got some gaps in the back of my teeth and haven't done anything necessarily about those. Several people close to me had commented on the fact that obviously it didn't look great. I also appear at a lot of public inquiries in court, so aesthetically it wasn't great. Now, it wasn't impacting on me functionally, but I recognised that it needed to be attended to. So when I was presented with the different options that were available to me in terms of how to fill the gap, everything was provided in terms of all the alternatives. It was explained to me very clearly what the options were. Now, it's very difficult to understand and follow sometimes because it was quite technical, but despite that fact, the dentist, Dr Prash, was absolutely clear about what was best in terms of the cost and value, etc. So he explained to me that there was an opportunity to have the denture, there was an opportunity for a bridge, or the alternative, of course, was to have an implant. And all of those were explained in detail. We decided and discussed together what the optimal solution would actually be. When I actually attended the first examination, I was very well taken care of by both dentist and the nurse, very much so. Following treatment and having the actual spacing filled has been obviously quite impactful. I think that what demonstrates the fact that it has been so successful is that people who commented on the gap previously haven't commented on the fact that my teeth are now my teeth or the front teeth are filled in. So ultimately, I think it's been great, and it has had significant aesthetic effect. I've noticed it in the sense of the gap's been filled, although there's no sense at all that tells me that that's not actually a real tooth. It's very difficult to actually identify that it's not part of my actual natural teeth. In terms of affordability, I think everyone's aware that dental treatment is not cheap. However, everything was explained to me in terms of value, essentially, which was excellent, enabling me essentially to be able to make the right choice. In this case, to have a bridge rather than a denture, but not necessarily requiring a full implant, at least at the moment, because there was the opportunity to actually have the gap filled by a bridge. If I was asked whether I would recommend the actual treatment to fill a gap, both at this particular practice, but also given the treatment that I was offered and how excellent it was, I absolutely would. No question about it. I would recommend this practice. I happened to only come here by accident purely when I actually had an emergency requirement when the tooth originally cracked, and it was the treatment that I received on that day that made me think that I needed to actually sign up to a package with this particular practice, because I've never been treated as well at another dental practice as I have at this. It's absolutely brilliant.